Good evening and welcome to another interesting package of the program, Easy Access to Healthcare for All, bringing you news and happenings around the National Health Insurance Authority and the health insurance space as it fulfills its mandates to Nigerians. I am Aisha Muhammad Ahmed, your anchor on the program. The NHIA is an organization created to bring succor to Nigerians. It is a vehicle for the attainment of universal health coverage. It is an avenue to give Nigerians quality health care at an affordable price. In this episode of the program, we will share the testimonies of Nigerians who have keyed into the NHIA and have enjoyed the scheme. Please stay tuned.
It's a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. Top on the news. NHIA Act will reform roles of HMOs and other stakeholders, just as Edo State Coordinator pays courtesy visit to NDLEA. These and more stories coming shortly.
As the implementation of the National Health Insurance Authority NHIA Act gathers momentum, roles of various stakeholders, including health maintenance organizations (HMOs), will be subjected to review. The Director General of the NHIA, Professor Mohammed Sambo, stated this when a delegation of Nigeria Employers Consultative Association (NECA) paid him a courtesy visit at the corporate headquarters of the agency in Abuja. Sambo stated that the globally accepted form of social health insurance made it imperative for roles of key players in the sector to be reviewed, including that of the regulator. Adding that the NHIA Act has significantly addressed the major defects of the previous law. Sambo said the NHIA Act does not jettison the present roles of HMOs and other stakeholders, but that their positions have been redefined. He stressed that the functions of HMOs regarding their service coverage in the private sector fell short of the demands of health insurance, insisting that offering health insurance in fragments to blue-chip companies held the prospects of making the country not to achieve universal health coverage. Sambo, who is an expert in healthcare financing policy, highlighted the ingredients of an effective social health system to include cross-subsidization and pooling of funds from majority of the population, adding that the NHIA Act mandates all health insurance services to have a basic minimum package. Explaining further the possible roles of HMOs, he said the fund managers can provide supplementary or third-party functions, saying that they are comfortably accommodated in the mainstream of the Act. The Edo State Coordinator of the NHIA, Honorable Raymond Ohomba, has paid a courtesy visit to the State Commander of the NDLEA, Edo State, Mr. Wakawa Buba. Speaking at the occasion, Raymond Ohomba said the visit was to foster partnership and collaboration with the NDLEA on how they can have easy access to health care, especially with the new NHIA mandate. He also appreciated the NDLEA on the work it is doing and have done so far in drug-related issues in Edo State. He said the health of the staff of NDLEA is very paramount, saying that a healthy workforce is a wealthy workforce. Mr. Raymond further used the medium to introduce the NHIA flagship program called Gift Ship to the NDLEA, letting them know that with the gift ship, no one is left behind. While responding, Mr. Wakawa appreciated the NHIA for the visit and pledged his support to the NHIA. He thanked the federal government for the program and made an appeal for the NHIA to register their newly recruited staff so that they can benefit from its programs.
program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Authority. The NHIA enrollee is the end user in the health insurance space. Their perception goes a long way in gaining acceptance for the authority. In this episode, we will focus on who the enrollee is, what provisions have been made for his or her benefits, and the testimonies of Nigerians who have enrolled and benefited. Please don't go away.
It is the objective of the National Health Insurance Scheme to see that every Nigerian enjoys easy access to health care whenever the need arises. Its purpose is for Nigerians to be able to access health care or go to hospitals without worrying about cost.
One of the major concerns of the healthcare system globally is how to mobilize resources, how to pool resources, and how to allocate resources to ensure effective delivery of healthcare delivery system. So NHIS is an organ of government that is created to do that. NHIS, if fully implemented, it has the ability to protect family and individuals and community from hardship of settling medical bills.
The satisfaction of enrollees justifies the establishment of the NHIA by the federal government. The NHIA enrollee is described as the king or queen of the scheme. Everything is being done by the regulatory body to see that he or she gets quality care whenever they need it. Healthcare providers are critical stakeholders under the NHIA because it is where the enrollee eventually ends up to access care. To ensure that enrollees are well taken care of when they visit their facilities, the NHIA regulates the healthcare facilities and carries out quality assurance to facilities regularly.
We look at the personnel. So, for example, if you are running a hospital, certain minimum qualifications for personnel and number of personnel are important. So for a regular hospital, a full hospital, you need doctors, you need nurses, and all these doctors, nurses, lab scientists, pharmacists, they must be licensed. And you also need, apart from the personnel, medical record personnel are also important, and then other staff like administrative staff, and all that, everything to do with human resource for health are all required. And then we need also the equipment. So you are going to look at the equipment, you are going to assess how the necessary equipment. For example, if you are looking at surgery, there are particular equipments, medical equipments that are necessary for you to be accredited for surgery. And also after that, we have environment. So we look at the environment. How suitable is the environment?
After the enrollee completes registration, his or her name is transmitted to healthcare facilities of their choice to access healthcare through the help of health maintenance organizations.
There's what we call global capitation. So based on the capitation is per capita, that's per individual covered. So we release that money to the HMOs in advance. We are giving them quarterly. So when we give them that quarterly, we give them the list of enrollees per hospital according to all the hospitals that have the HMO, where we have our enrollees under every HMO. So that's how we get it. And then it is now the HMOs that transmit the list to the hospitals or health facilities.
Health insurance being a contributory scheme, different parties play different roles to see to its success. While the NHIA is the regulator, the enrollees also have a role to play as they access health care.
So they have a lot of roles and responsibilities to one, in terms of enrollment, it is their responsibility to choose the hospitals that they want to go. We don't allocate them. So they choose. If they go to the hospital they have any complaint, it's their responsibility to complain. In fact, they even have the right to ask a hospital, how much is my bill? Because what we are hearing is that some people go to the hospital and the hospitals are not telling them the correct thing. They will tell you to pay 10% of the cost of the bill, which is not correct. You only pay 10% of the cost of the drugs. So they have the right to ask, how much is the cost of the drugs, so that they know what the 10% means.
The authority works assiduously to see that healthcare providers get their funds in good time and are not owed, so that it does not hinder enrollees from accessing healthcare. For this, healthcare providers remain grateful.
The NHIA is trying to make sure that the facilities are not owed after offering service to their patients, to their clients, which is what has been obtainable in the past. And it's a good development, and this is encouraged so that all the loopholes will be covered and whatever is being owed will be settled amicably, and the facilities will be happier to offer services to Nigerians that are registered under the scheme.
The outcome of all the efforts by the authority is in the different testimonies shared by enrollees who have accessed care at different points.
I'm a staff of Fair Engagement.
Hajia Zaliyatu Umar is an enrollee who has benefited from the scheme. She tells us her story.
During my NHIS with NISA hospital, and I have never had issue. I'm a diabetic patient and I have asthma. So whenever I go, they will attend me promptly. Yeah. They used to mobilize me, and I had never had any issue with not cover.
Blessing Manasseh became an NHIA enrollee by virtue of marriage. She says she has enjoyed subsidy whenever she visits the hospital and calls on Nigerians to also get enrolled into this scheme.
Nigeria, please try to enroll on NHIS. It's the best so far. It saves you from spending. It helps. It's a great way of helping life.
Omar Zanna says he and his family access care at little cost since joining the scheme.
Well, since the inception of the scheme, I think I have not experienced any hurdles, and I'm really enjoying it. Not only me, with my family. Yeah, so it's really okay for me.
Success stories on the benefit of health insurance abound, underscoring the relief of prepaid health care.
It's a service I'm enjoying through my husband.
Okay.
It's my husband that is the one that is benefiting. I happen to be a beneficiary as a wife. So far so good. I've really enjoyed the services. You know, there are times you may not have immediate cash with you, an emergency will just come up. Just like this very last night now, my baby started running temperature and difficulty in breathing, and I was not buoyant enough. So that is when you really know the impact of NHIS.
There was a time I was really ill and I had to go to the hospital. So when I got there, I was really expecting, because of the nature of my ailment, I was expecting that I would be given a very high bill. But I was so surprised, you know. After all the treatment that I was given, I wasn't asked to pay anything at all.
The goal of universal coverage is to give every Nigerian the freedom from out-of-pocket expenditure for healthcare needs, which will in no small measure increase the well-being of the masses.
You're still watching Easy Access to Healthcare for All Nigerians. And in this segment, we shall take a look at stakeholders in the scheme and how they have been partnering with the NHIA to give Nigerians easy access to healthcare. Today, we shall be hearing from Dr. Rock Amego, Director General, Edo State Health Insurance Commission. He speaks on the new NHIA Act.
The new NHIA Act, just from the name, it has changed from a scheme into an agency. And so that gives us more autonomy as an agency to operate independently and also in collaboration with other stakeholders. But more importantly, what the Act has done for us is that it has made health insurance mandatory. That makes it easier for other states to follow because a lot of state laws are at variance with what the National Health Insurance Agency is now doing. All right, so you have an impetus to say we want the health insurance scheme to be mandatory in our state since the National Health Insurance Agency is already following in that line. And what does that do? It brings a lot of buying into the health insurance space. You know, in a country as we see today, when you're practicalizing health insurance, especially from the informal sector, people believe that once you ask them to join health insurance, it means that you are calling illness to them. But that's not the narrative. We're just telling them that you should prepare for the unforeseen future. Health challenges can come irrespective of age, gender, or even income. And so what this act does for us is that it becomes mandatory. Anybody who is doing business with government, anybody who lives within the ambience of that society, you know, within the confines of that society.
He describes the new NHIA law as a pillar that states can leverage on to boost their health insurance operations, especially as it relates to their laws.
For us in those states, when we set up our law in 2019, our act was mandatory. And so this just further reiterates what we have been saying. And so we think it's a welcome development. And what this also does is that it makes some of these deductions and spending statutory so that, you know, the bottleneck and bureaucracy that used to exist in time past, those are now wiped away. The decentralization we're talking about in the health insurance space has come to life. You know, it's now working. So each state has a mandate to say, okay, once you want to come and do business in this state, once you're a resident within our confines of our space, you must join the health insurance. And so that those numbers helps you to buy more health benefit package. It's a win-win for the health insurance space. It's a win-win for the enrollees and a win-win for the country at large. We can only get further, you know, by this kind of policy that governments are bringing about, and it's better late than never. And so we're excited that this has come, and this will help our insurance, you know, take a good boost in getting more enrollees into the scheme.
Dr. Rock says the Act will foster collaboration with states and will make the operations seamless.
It just gives us a very good impetus and background to say what we are doing. A lot of regulatory functions that the NHIA has that they used to do before, sometimes that they would have to go through the bureaucracy of presidency, the Ministry of Health. Now some of those bureaucracies have been broken because autonomy has been given to them, just handed over to them by what the President Mohamed Buhari administration has signed into law. So a lot of capacity building now will improve because, you know, like those, you know, tributaries or lines that you have to go through, those have been cut short now. So if you have to go through 5-6 people, now you're only going to go through one person. And so the development we're talking about, sometimes we write letters to NHIA, you see that they respond to you, but because of this bureaucracy. And so with this act now, it's a seamless process.
He stressed on the importance of the aim of the law as stated in the new NHIA Act, which is to promote, integrate, and to regulate.
I give you an example. If you come for example, Edo State and you fall sick and you went over to Lagos State, it would have been difficult for you to seek the health insurance. But with this NHIA Act now that has come to stay, there's something we call interoperability between the national and the various states. So if somebody who is registered in Edo State, for example, and goes to Katsina and falls sick, because of this synergy and interoperability he will get health care for free. And so the back-end administrators of that healthcare will just synergize at the end of the month and retire their claims, and the claims are sent to them. So it is perfect. It is never been done in any space within our country.
Dr. Rock says the optimism about the Act as a vehicle for the universal health coverage cannot be dismissed.
Universal health coverage, as the name implies, universal health coverage is coverage for everyone in the universe, you know, starting from our local environment, from state to national level. But there's also a definition of universal health coverage. There's a particular percentage of coverage that you're expecting. Presently, our coverage in national health some time ago, before it was decentralized, was 3%. But our statistics is roaming between 10 and 15% now. And so what this act does for us is that it helps to increase coverage, because the barrier of wherever you come from, whether you are in the north, whether you're in the east, or whether you're in the south, that has been abated. And so this act helps, you know, people to come onto the scheme in a seamless process.
In conclusion, he says the act will foster interoperability within health insurance space, in turn, making accessing healthcare much easier.
Now we can easily do a peer-to-peer review, all right? As from the ICT background or platform to even our processes. You know, this interoperability can also flag off, systems, or when you see overutilization of a particular patient in terms of drugs, or in terms of, you know, we have difficult patients, we have patients who are hypochondriac. What this act does for us is that, you know, many of those algorithms have been written in our ICT. So when those challenges comes up, it easily flags it. And if you see in our climb, for example, the problems and the challenges we have are not very different from when you go to Northeast and Central. So what this act also does, because there's a peer-to-peer review that is almost on a daily basis. So we can quickly see a problem even before it emanates in your own client, because you have seen other people getting that problem. And so you can quickly nip it in the bud or look for capacity in ways to solve that problem.
That was Dr. Rock Amego, DG, Edo State Health Insurance Commission, speaking on the new NHIA Act and the health insurance sector at large. Coming up next, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
How do enrollees access specialist care?
For specialist care, the enrollee will first attend at their primary provider, which in NHIS parlance we call the gatekeeper. So you go to your doctor where you have registered, and then the doctor, if sees anything necessary, will refer that enrollee for a secondary service. If the hospital offers that service, then there will be an internal referral. However, if the hospital does not offer that service, then it's referred to a center where that service is offered, and the hospital, therefore, in both cases, the hospital will actually get in touch with the health maintenance organization, who will actually issue the referral code, and then the hospital gives the notification of the referral to the patient, who either goes to the internal place if the hospital offers the service, or goes to the other service provider that actually offers that specialty service.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. If you have questions or comments, please send them through any of our contact mediums on your screen. You can also watch the program anytime, any day via our YouTube channel. Join me again, same time, same station, for another episode as we continue to bring you more stories of happenings around the NHIA. See you next week.